Welcome to the Wednesday Morning Roundtable, a program of the YMCA. Not the YMCA that's in the news today for the scandal with the Syracuse basketball team, but the other YMCA. We have a good panel discussion this morning, and I'll get to introducing them in a minute. But we do have a warm-up act this morning. Rob Forsey, the publisher of The Citizen, is here. He's been with us for about a year and a half now in Auburn. Has done a super job, I think, getting out into the community, meeting people, getting known. He's got a very special project that he and The Citizen operate called Warm the Children. And we, as we did last year, provided him with a couple minutes to talk about this program and see what we can do to help. So, Rob, would you like to say a few words?
Yeah, thank you. So we changed everything on all of you within the last year as far as Warm the Children goes, for those of you who contributed. What we used to do is the charity would go out and provide an $80 voucher for folks to take to go shopping, like at JCPenney's and stuff like that. Well, this year, actually starting last year in January, we went out when it was clearance time at Walmart and JCPenney and Sears and bought their coats. And it was literally pretty funny because I'd walk into the store and go, I want to buy coats, and they'd say, well, how many? I'd say, all of them. And they shuffle me off thinking I was a lunatic, and then finally I got somebody to answer a call and started buying stuff up. And apparently I helped Sears out so much that they're closing. We did get quite a few coats from them. We started this year with over 1,000 coats. We did our distribution day right before Halloween, thank goodness, because the weather changed. And we have reached over 630 coats so far that we've distributed this year, which is about 150 over last year's number. So it was a great increase. If you're not familiar with Warm the Children, what we are is it's very simple. You give us money, we buy kids that can't afford them coats in Cayuga County. That's it. I mean, it's no big thing. It's a partnership between the Rotary, between Cayuga County Community Action Agency, and between the Citizen. We've been doing it for years. We fundraise, try to make sure that we get everything taken care of. Karen is part of the board in the back of the room, and we started this year with a discussion of what is the need. And even though we handed out 630 coats, we kind of did our barometer off of the free and reduced lunch program in the schools, because we figured that's probably a good indication of who would need it. And there's over 700 children in Cayuga County that take advantage of that program. And we figured there's probably another 200 to 300 at home that aren't school age yet that we want to be able to help too, that are the brothers and sisters of those children, or not even in school, or don't have a sibling in school. So we're probably looking at about 1,000. So being able to get out and give out 630 coats is great. It's a huge accomplishment, and it's more than they've ever done. And I'm very proud of everybody and all of you for helping us to get to that point. But you can see that when we get into next year, that's going to be something that we have to do and make sure that we continue to increase those numbers. So anything that you could do today to help, that would be great. There's forms on the tables. I didn't think laying them on the chairs was a good idea. If you want to make out a check, it's just to Warm the Children. That's all you have to make it out to. And I guarantee you that we have no administrative costs on it. I do this all volunteer, all my hours, all my people's hours, to be able to administer the financial side, and then also go out and buy coats and inventory them. And folks at Walmart will tell you that we are not the best retail company in the world, but we're the largest for one day for kids' children, so, or at least in the county. So anything that you can do to help will be greatly appreciated. You can drop it off at the front desk on the way out if you want, or drop it by the Citizen, because I'll be there if be able to help you out if that happens. Any questions about what happened or anything like that this year? Thank you very much.
Thank you, Rob. Next week is Thanksgiving. We're all very fortunate. Let's see what we can do to help some other people. Rob also helped us this morning. I don't know if you saw the front page of The Citizen, but there's a big article on the Tombstone project, I guess, about heroin, the tombstones placed up at the community college to bring awareness to the heroin epidemic. We have a distinguished panel this morning of presenters who are going to discuss this topic. We'll give them to about 8:40 and then we'll open it up for questions. Let me introduce them quickly. To my right is Lieutenant Joseph Weeks, who has been with the Cayuga County Sheriff's Department since 1992 and became a detective in 1996. He has supervised the Criminal Investigations Division since 2003. Prior to the Sheriff's Office, he was employed by the Weedsport and the Skaneateles Police Department. Joe Weeks. Next is Ray Bizzari, who many of you know. Ray is the Director of Community Services for Cayuga County, overseeing local mental hygiene services and the Department of Social Services. And to Ray's right is Kevin Hares. Kevin is the Executive Director of CHAD, the Confidential Help for Alcohol and Drugs Organization, for 37 years. Thanks. He started when he was 10. And he has been a credentialed alcohol and substance abuse counselor since 1983. Gentlemen, the floor is yours.
I want to give you sort of an overview about how we got to where we are today, and then these guys will talk about their respective roles in this, because it's a big problem and it requires a lot of different folks doing stuff. We're going to speed through this pretty quickly because we've done it a few times, and then let you have as much time as possible for questions, because that seems to work a lot better. So we have responsibility for planning for mental hygiene services in the county. Under that is drug and alcohol services. There's a community services board, and there's a subcommittee of the community services board, drug and alcohol subcommittee, that Kevin reports to. So that deals with, right, substance abuse issues. So a couple, and Tim Donovan's on that committee. You know, Kevin reports to that. I don't know if there's anybody else here. Rob's on the drug-free community committee. So they started looking at, I think it started with those highly caffeinated, highly alcoholic drinks that were, you know, making an appearance, and people were getting sick and overdosing because the caffeine kept them awake. They didn't know they were too hammered. We did some stuff around that. That sort of led into synthetic drugs was a big problem in the community, right? These guys couldn't arrest people. They couldn't test for it because they changed the molecules. People were getting really high, really sick. There was a lot of stuff going on with that. A bunch of things happened out of the work that the committees were doing, local laws and different sort of treatment opportunities and things like that. And then Jim Stoll joined the subcommittee, who's the undersheriff. You know, he works for, you know, with Dave Gould, and Jim's leadership has been really important about bringing a lot of other people to the table, like law enforcement, medical providers, the hospital, not just the agencies, other sort of interested people. So we started talking about prescription drugs, and you know, this is a terrible thing for us. I mean, and a lot of people get caught up in this deal, and then how that led to, you know, a heroin epidemic. There was an I-Stop program that people go in and take a look at to see if you're getting drugs from other doctors, because this was happening a lot. Good law, unintended consequence was people couldn't get prescription drugs for $30 a refill. They had to pay $40, $50 a pill. They needed 15 pills a day. Heroin, Joe will talk about, you know, what people are paying for that. So that's a sort of cheap alternative to that. So we're really concerned about this. It poses a lot of challenges for us. We're looking at we have formed a committee to look at a countywide prevention program based on kids. You know, it's really just, it's targeted to kids. That's where the funding is. We don't have this sort of operation going. So, you know, we're really concerned about, obviously there's a lot of people who are using, who are jammed up, and you'll hear about how difficult that is for them. And we want to make sure that we don't create new users. So we want to do some work clearly around changing the hearts and minds of kids, because what the research is showing, and we're getting fresh numbers from the school districts now, kids' attitudes about drug use and what they perceive their friends' attitudes and their parents' attitudes about drug use, it's a little frightening, because a lot of people think it's kind of okay, and that most people really wouldn't care. So the medical profession, the doctors, the advertisements, this whole business we got going about, this bothers you, take this, they're aware of that, and it legitimizes the idea of using certain sort of substances. People get jammed up. So that work continues. These guys are a big part of it. That's like the general overview. We're doing a lot of work. That work continues. If anyone's interested in helping, just ask one of us. Again, you should really come away from this feeling pretty good about the sort of levels of cooperation between a whole bunch of different kind of folks and agencies that sometimes didn't work together before. So I think that's exciting for us as a community. So that's that for me, and whichever one of you guys want to go.
Joe's got the kit, so I'll go next. He's got the For those of you who don't know treatment, it is not a panacea, which means it's not just because you enter treatment doesn't mean you're going to change. So I have to debunk that because there's sort of a lot of feeling that kind of like if you go to college you will graduate. It doesn't work that way. Treatment is a process, and the thing with treatment for heroin that we really are trying to wrap our heads around is immediacy, which means when somebody wants it, we try to respond as quickly as possible. The problem lies in the system I work in. It's been dismantled since I started, which is kind of sad to think that we had all the tools at one time and they took all the tools away. And what I mean by that is just like with medical care, the first round is usually you go to your doctor. The doctor will diagnose you, and if the doctor can treat you in an outpatient setting, voila, you have that. If the doctor finds a more serious issue, he has the access to the hospital and then possibly long-term care after the hospital. Treatment really runs parallel to that in the sense that outpatient is the first line. We get everybody coming in who's trying to learn what they have, trying to address it. If we cannot treat that, we go to the next level, which is inpatient, which is 28-day treatment. The problem is that's like pulling teeth. We all know that we all have great health care coverage, but we also have this thing called the managed care piece. And the managed care piece is really taking apart what we do, which means the 37 years of experience I have, I cannot use that to get somebody into a treatment program that I think I have the skill sets to do that. They don't believe me, they don't meet the criteria. And with the heroin addict, if you don't really get them moving into the system quicker, you run into a whole bunch of sidebar consequences, which Judge Leone runs into, which means they start stepping out and stepping out. And this is a population that you all have to understand is your kids, your parents, your friends. There's no profile here. It's not some group of people on social services or a group of hoods over in another. This is everybody, okay? And the problem lies that it creates this group of folks that I think are the most intelligent users I've ever run into, which is not a good thing because they're one step ahead of you as far as what you're trying to accomplish. One of the things we see with regularity is they do break into houses. They do steal jewelry from grandparents or parents because this addiction is pretty extensive and it's expensive. The thing that Ray alluded to that I'll share with you is that I don't think I've met anybody yet through the office that started out on heroin. Almost every single person did a painkiller or a synthetic opiate initially. Some to get high. They didn't go with a pain issue. It was just plain, they read about it, their friends told them about it, they tried it. The other way is there's another population that is actually pain management addicted, which means they've actually gotten an injury, we're given medication, and over time there's this thing called tolerance, which means you need more of that drug to do it. Even if you don't abuse the drug, you will develop tolerance. So what happens to that population is they start to overshift and take more medication, and it actually can become a full-blown dependency. And one of the things with the medical field that I really, really dislike is once they find out you've abused your medication, all of a sudden you're discharged from the practice, they're done with you, instead of them seeking help for you either in an addiction program or at a pain management clinic. So those two populations are turning to heroin because heroin is cheap, and I'll leave all the details to Joe because he's got those down. But it is much cheaper than buying a synthetic drug on the market. And what happens is, then you talk to kids who will tell you they'll never shoot up. And then you see them again in a month and they've shot up. And one of the things they'll tell me is the first time they shoot up, they can never get that back, which means they keep chasing that again. But we're an addictive society. I don't care what anybody tells you. If you look at all of our lifestyles, we're addicted to something. Addiction is not focused just on drugs. So it's how we use something. And the first course I took in college, and I think it's the most logical one, is we maximize our pleasure, minimize our pain. That's why we use drugs, quite simply. okay? You don't have to be a scientist to do all the brain stuff that goes with it. I mean, there's a lot of that out there. But the key is getting people help when they ask for it and being able to get them the proper level of care when you do that. It's also not a standalone product, which means we're not just going to treat the individual because we have to treat the family, but it's really difficult to get a family to come into treatment because of the embarrassment, guilt, and shame aspect of it. So we're trying to do more with that. But when you work with parents whose kids are in trouble, the pain in their situation is really difficult to handle at times because they've done everything they can. This is their special child, and this kid's in deep trouble. And like I said, these are not kids who would fit any kind of profile. So clearly, we have tried to come together and look at this from a unilateral approach, which means back in the days when I started, and really dating myself, but Sheriff Spotable existed. He did not like me, did not want to see me. Dave Gould, who's now the sheriff, embraces me. And those are very strong changes. Because what it means to me is I can call up the sheriff's department and get some things done from that angle. I can call Ray and get things done from the mental health angle because a lot of the folks who present to us also have untreated mental health issues. So, the key is collaboration, cooperation. The hotline that the sheriff's office has been a wonder to me because I get parents who call and they know who's dealing to their kid, but they don't know what to do with it. The hotline's a great place to send them. They feel like they've done something, they feel like they have a response to it, and the sheriff's department does a really good job of taking care of that. So that whole collaborative approach, somebody used the word the other day, and it's true. We used to work in silos, and I didn't quite wrap my head around it until I started listening to what we were talking about, and it was true that a lot of agencies used to have their turf, did their thing, and didn't really talk to anybody else because there was a funding issue or, whatever. Now there's such an overlapping of services that we're kind of almost seamless now, which I think is awesome, and it's good to see it before I actually step out someday, that we can actually have these conversations. Ray's been a big, big help to me because he's worked in the system. He's been on the other end of the thing, and what comes out of it now is we can actually address things as they arise, which is really awesome. The thing with opiates, I don't think it's going to go away right away. This is not a flash in the pan. This is not something that if we just, bring force to it that will correct it. I think the thing that Ray talked about, there's always things that you think are going to work out right and they don't. One is the iStop program. It's really taken the pill going down the hill a little bit, which is great, but it didn't change the addiction level. It just switched the addiction to the actual heroin. That's problematic because clearly you're starting to get into heroin as a product that nobody really controls as far as quality or quantity or whatever else. And Joe even told me a story one time of a crew that went over to Syracuse that were going to buy, and they used it all up before they even made it back to Auburn. And that tells you how serious this is. If anybody has dealt with someone who's dependent, it's tough because it doesn't always work out the way you want it to. But we don't close our doors. I've had people, committed 17. They're now, what's the math on that? 37. But the key is, recovery is something we never shut down. We don't get angry at people for not figuring it out. If you've all tried to change something, weight, professions, whatever, you kind of stumble, you don't really like it, you don't really follow through. We do not go there with people. If you come back in, as long as you haven't been violent verbally or physically, you're welcome back to our agency. And we've seen people come back at 30 or 40 who actually finally ran it out long enough that it was time to make the change. Because some of it is you kind of got to work it out yourself and decide it's time. Because I use the example of college. I've seen Dan Larson here, so he'll understand this. Because you go to college doesn't mean you're going to learn. Just like with treatment. Because somebody forced you into treatment doesn't mean you're ready to take on what we're offering to you. But we do know that when you walk in and you decide it's time, it doesn't work. People do change. But my problem is, with all the years I've been in this business, I still have not seen a change in the general public attitude. Which means if I walked up and said, I'm a recovering addict, I can guarantee you 2/3 of this room is going to have a negative thought process about that. Okay? The other third may have experienced it in their family systems, and they'll have a positive thought process about that. But we have a medical condition that we can't speak about. And that's been my biggest consternation through my entire career, is that you can't walk out the door and say, I've been sober 7 years without a consequence. I've seen employers, pat somebody on the back for change and then fire them or distrust them. Because we build it on our attitudes, and that's the part you all got to check, is what is our attitude, and is our attitude one in which we can support change, and if you can, then recovery is a piece of change, because it's not just alcohol and drugs, it's your emotional state of mind, it's your physical state of mind, and in a lot of cases it's untreated mental health issues that finally got clarified, and now you can actually get to the county mental health center, acute counseling, and do something around that. The other thing is, and I really need to warn you about this, the drug Suboxone, which is buprenorphine, is getting a lot of paper because it's a drug that they give people almost like methadone. It's supposed to be a maintenance drug. Well, my experience with the drug is it's a detox drug. It's really supposed to put you into withdrawal. You're supposed to use it over a 3-day period. It's done. The pharmaceutical company that makes this drug has marketed it now as a maintenance drug, which means we have a bunch of folks who are out there who just want to take a pill and get better. And it will work. If you look at it like weight loss, you can take a amphetamine, which are now banned, lose the weight, but if you don't change your lifestyle, the weight is right back as soon as you stop taking the pill. So I'm really leery of pharmaceuticals who started some of this problem, marketing a drug that supposedly solves the problem. So be very, very clear about that when you're looking at it, that it is a medication-assisted therapy. It is not the answer to the question. Because when we highly control it, because we do give it out, I think we have 20 patients on it, but if you don't come to group, if you don't stay clean, we'll cut you off. And when Fridays come around, we all hide because we get these folks who are real angry that their medication is not coming through this week, which scares me because that's drug-seeking behavior that's not being extinguished, okay? So clearly, it is a major issue in this community. I don't think any of you in this room probably haven't been touched by somebody, and I don't also want to lose the fact that alcohol is still the #1 abused drug, and will always be. So I think the key to this is, I ask you to support recovery. I ask you to support people in recovery. And in your workplaces and in your venues where you are, make sure you create an environment where people need help, that you support them getting help, okay? The one aspect about recovery that people get confused, to me, is personal responsibility, which means Judge Leone used to run a drug court. And he understood very clearly from the beginning that the person has to do the work to get well. The program isn't going to do it, the court's not going to do it, the lawyer's not going to do it. So if you don't follow what your prescription is for change, then you get a consequence. I believe wholeheartedly in that, because with consequences does come change. When you fail out of your first semester because you didn't pay attention, you get that opportunity to go back the second one and clean it up. A lot of kids do very well that second semester because now they've been challenged. So clearly, what Ray and I and Joe are asking is that you folks do support this, do support change, and clearly realize that, and I think maybe I was a little naive when I started, but I kind of thought I'd put myself out of a job. That's not happening, and it's probably never going to happen. But I know this, that it is a job in which I truly, really, really love, and it's a job in which it gets easier when I get more collaboration. So clearly we're at a stage where we're trying to get out there and let you folks know that there is an answer to the question. It's not an easy answer, but it is a holistic approach, which really means everybody has to be part of the process. So stay with us, work with us. Don't be afraid to call if you have somebody at your place of work or in your family. I still answer every information question that comes into the office. I probably field about 4 of those a day. Some take 5 minutes, some take 20. But I also believe that if you call someplace and they tell you, I'll get back to you, or you called the wrong place, that can crush somebody's hopes. So clearly, and you'll probably get me if you do call, I try to do what I can with it so that people at least have a pathway to move, like we've got answers to their questions, because there is NA, there is AA, there is Al-Anon. There is a lot of programs out there that are not controlled. They're self-help, and you can access those any day of the week without money. All you got to have is motivation to go. And you can go to open meetings, which means you don't really have to know if you have a problem or not to go to an open meeting. And it's also the most important tool I have, because the people who have good recovery, in my opinion, have connected to a self-help group. Because relapse is a process, and where we see people go wrong is they think they get well, and then they forget the things they did to stay sober, and then they'll relapse, okay? And relapse happens way before the physical relapse occurs. The mental relapse happens. We try to teach people to look for those warning signs to get to a place of safety before they make that decision. But the simplest way is to get to a meeting. And meetings are, if you've ever, saw, most people see them on TV, but they're a welcome, warming group, and they're also going to tell you what's going on. They're not going to mince words with you. So, in conclusion, I just ask you to keep supporting us, keep doing this. We're pleased. Like I told Ray the other day, I don't think I've done this many public presentations in my entire career that I have this year. But the beauty of it is it means somebody wants to hear what we have to say, and people are interested in the community to see change. So that's really your role, is to help in the change process, because every one of you have something you can offer to it, okay? And at minimum, your support or your information to call somebody. So, Joe.
I'm going to start by passing around an evidence bag here. This is a drug kit taken from a 22-year-old female who had a 22 bag a day heroin habit back in July. I want you to pay particular attention to the size of the wax paper envelopes that the drug comes in. Basically, drug addiction, aside from the health effects, is a financial burden. Once the addict is unable to support their habit through legitimate financial means, they turn to crime, and that's where we get involved, whether aside from the obvious death investigations that are created from drug addiction. Heroin addicts generally are started out with prescription painkillers, whether they were prescribed by a doctor for some sort of injury or whether they started out using them recreationally. But almost every single heroin addict that we have dealt with started with prescription painkillers of some sort prior to going to heroin. Prescription painkillers sell for $25 to $30 a pill on the street. Heroin sells for $7 a bag. So you can see the obvious reason why they switch from pills to heroin. Heroin addicts very often become heroin dealers because of the financial burden. They have to buy more product than they're actually going to use themselves to sell to their friends in order to make a profit to cover their next run to resupply themselves. Most of the heroin that's in our community is coming out of the city of Syracuse. 3 or 4 kids will get together, jump in a car, drive over to Syracuse, buy their stuff, and leave the house in Syracuse, stop at the first gas station they come to, go into the bathroom and shoot up. We get a lot of tips on our tip line that there's somebody making a run, and what we find is that by the time we stop them, by the time they cross back into Cayuga County, all we're finding are empty bags and needles because they've used it before they even got back to our county. So it is a very difficult crime for us to prosecute as far as catching the low-level users and abusers. They start out by stealing from family. Heroin addicts are a little bit different in their criminal activity than the crack cocaine addicts or the powder cocaine addicts were. The violent crime, at least, I can't speak to other areas, but I can speak for this area. The violent crime doesn't seem to be as bad as it was with crack cocaine. It seems to be more of a sneaky crime, stealing from family, neighbors. Somebody will go away for 2 weeks. The heroin addict that lives next door knows that, and they sneak into the neighbor's house and steal their jewelry, steal their change jug, steal whatever they can steal. Down to the local pawn shop, pawn it, from the pawn shop to Syracuse to buy the heroin. And that's basically what we're seeing. If we see a residential burglary, we go in there and we find that the medicine cabinet's gone through. Maybe the dresser drawers have been gone through for cash. However, the medicine cabinet's open and has been rifled. That tells you right then and there that you're dealing with somebody that's got a heroin problem. They committed that burglary because they're looking for pills in the medicine cabinet. They're looking for cash and jewelry, but they're looking for pills also. So that is the sort of thing that we're dealing with. And again, heroin addicts are becoming heroin dealers in order to be able to support their habits. If they need 10 bags a day, they'll go to Syracuse and maybe buy 50, come back and sell the other 40 to their friends to make just enough profit to go back and buy 50 again a day or two later. I'm going to leave it at that.
I'm going to ask you one question before you start getting to us. See how responsive you are. How many people in this room, if you wouldn't mind raising your hand, have experienced a family member or a friend who's had a substance abuse problem? My point's made. So we're open to questions.
Questions? Laura?
How do you know if someone's using heroin? I mean, I know you said about, stealing and all of that kind of stuff, but what is, how is someone experiencing heroin?
Well, you're going to see, from our perspective, you're going to see changes in, take a 21-year-old child, for instance. You're going to see changes in their behavior. You're going to see possibly worldly possessions that they had are gone. Where's Grandpa's shotgun that he gave you for Christmas or whatever? It's gone because it's at a pawn shop. So you're going to see a different group of friends. Heroin, I'm told by the people that I've interviewed, is a drug of seclusion. They're not sitting at the typical teenage beer party, getting up from the couch and going in to shoot up. It's 5 heroin addicts sitting around together at a party shooting up. So basically, you're going to see major changes in behavior and financial burden.
You mentioned these dealers that are going to Syracuse and you're apprehending them and they've already used. Are they driving under
Yes.
the influence?
Possibly.
And okay.
Possibly.
And is the influence like alcohol? Are they judgment impaired? Are they?
Well, it's more difficult to identify because there's no odor associated with it. You don't walk up to the window and say, I smell heroin. So, it's difficult to identify.
But it is a depressant drug, so obviously your reaction time,
Okay.
all of that is all the same, if anything, probably worse. And heroin only lasts about 15 or 20 minutes, contrary to what people think. That's where the multiple usages come in. And one of the things that you all need to know is we've been kind of pretty much out there with the deaths that occurred, which is why the actual program is up at the college. But where people die is actually when they quit for a while and they return to use. It might be just a couple of days or it might be weeks, but they come back to the level of use they were doing when they quit, and they try to do it that day or that night, and basically you suffer respiratory failure is really what, because it just depresses your breathing to the point where you stop breathing. So if you put a lot of that into your system and your system is not used to it now, that's when people overdose, and that's when we've had people make very bad decisions in this community about what to do next. That's where Good Samaritan law comes in. We ask that everybody understand that if you call 911, you will not be penalized for getting somebody help. The sheriff's office has done a good job of promoting this and getting the information out there. But we really want everybody to understand that, because if everybody's hands went up in the room pretty much, somebody's going to be touched by this. I just saw yesterday's news, maybe, the first time where somebody used one of the Narconon kits, where somebody actually got saved, by a police officer, where they had the kit, they were trained to do it, and I think it was in a parking lot at a mall or something, but they responded, and that's one person who did not die. So clearly there are other things going on out there that are just safety issues, let alone treatment or others. But that's a big piece of this. But the driving piece is probably huge.
So there's a difference between, I think that a couple of different approaches, and Kevin just talked about Narcan, which is Naxalone. It's an inhibitor, so when it's administered nasally, it blocks the absorption of the narcotic, so it resuscitates people. They start breathing again because it's a depressant and stops people from breathing. These are harm reduction strategies. So you have treatment where you talk about abstinence and you talk about getting straightened around and doing the work that you got to do. And then you have You have harm reduction strategies, which are like methadone, Narcan, and, other kinds of maintenance drugs. So that causes a big discussion in government and the treatment community about, I think that we've heard things like, if you're giving families, because you can get it now. You don't have to be somebody who uses. A family member, police officers are being trained and being equipped, today as we speak. There's a lot of discussion out there around, just really saying it's okay to use drugs, and this is giving permission to people to do that, and you're giving them the tools they need to keep. So, it's just worth hearing that. I mean, I don't know, why would you let somebody die just because, they were using, somebody said something at one of these things we were at, I don't even remember where it was or what. You have a choice the first time you use, certain, some people have a choice the first time they use a drug. After that, they don't have a choice anymore. It does impact people's neural pathways and all that sort of stuff, and it is a disease. It's known as a disease. There's a lot of literature to it, and I think that, we should sort of recognize it that way and treat it that way.
One more thing, we do have the med return box out at the sheriff's office at the public safety building. It's no questions asked. It's in the lobby with public access. You walk in, dump your prescription painkillers in the box. It's just like a mailbox, and out the door you go. That is probably one of the biggest things that the community can do to help this problem, is to throw that stuff away when you're no longer using it. Get rid of it, throw it away.
Yeah, the first thing you can do, because Joe and I have talked about this a lot, we just did, I think, 100 and some teachers that we support a couple weeks ago, but we ask everybody to go home, get into their medicine cabinet, their parents' medicine cabinet especially, grandparents, and look in there and see what's there. And if there are things that shouldn't be there anymore, get rid of them. But the program at the jail is where you can take them, and I think also pharmacies run specific days where you can take them. But if you remove them, and there are younger people in the family, because every family is extended on some level, you've just cut one avenue out that may actually be the starting point for somebody, because it's a lot easier to get it out of the medicine cabinet, read online what it does, or talk to your buddies, try it. Because one of the things that scares me the most is people talk about from the first high, they're pretty much there, meaning they like it, they want to go back. So if you can not give them that opportunity, there's something that might change there. But go home, look, you'd be surprised, because I know most doctors, I think it's changing now, but any kind of injury came out with some kind of pain medication. So get rid of it, because if you don't use it, it does expire, get rid of it.
600 pounds of prescription drugs they just incinerated, or whatever the hell you do with them to get rid of them. Over like 4 or 5 months just from the... How much does your pill bottle weigh? 600 pounds.
The box gets emptied every other day, and it fills a box. Almost every other day. So people are responding to the problem and are throwing away their drugs.
The people that are users, is there such a thing as a casual user, or once you start using it, you have to have it every day?
Well, we're trekking into turf. What I would say to you is I believe that there are a population, I look at alcohol as an example. I think there are people who can use something and not have a consequence to it. Why that is, I do not know, but I do believe that at some point in my lifespan, they're going to find a genetic connection to addiction. That means just some people have a predisposition. If they use, they've lit it up, okay? So no, there are some, an example is painkillers. A lot of people can take a painkiller during the course of an injury, quit at the end of that, and they're fine, okay? A lot of people drink alcohol, can put it down, never get in trouble with it. And then there's people who smoke pot, who do other drugs, and they don't seem to run into trouble. But I think that's a minority, but they do exist.
So is shooting up the only way, the only form?
No, you can snort it. There's a different set of, you can cook it up, snort it. There's different ways to do it. But
It's really high quality now. Yeah, really high.
Well, I just wanted to mention, I know you're focused on drugs, but the other reason to take prescription drugs to the sheriff as opposed to getting rid of them by flushing them down the toilet or something is just to not put them into the environment.
Yep.
Correct. We sent out, one of the things that, so we've done a lot of things, so this is a terrible story, and it's kind of like a plague upon us, but there are things that we can do and have been done. We sent literature out to all the physicians and the pharmacies in the county there's a best practice way of prescribing narcotics, painkillers, benzos, and stuff like that. And it isn't successive 30-day scripts. The American Medical Association has a protocol for that, which is different than most people use. So we sent that out to doctors, and also information on, they all have to do CMEs, continuing medical education credits. So we sent information out to them. It was just sort of like, hey, look at, here's something that you can do. This can be helpful in this sort of way. You know what I mean? Because you can restrict what floods the market. You can stop people from starting, and we sent home stuff with the schools to parents, keeping your medicine cabinet safe, and inventory, locking stuff up. Some common sense. There are things that we can do that do make a difference. So big problems have a lot of levers to yank. There isn't any one big great solution that fixes everything.
I see Katie, and then I see some more hands back there, so we'll get to you.
I have two questions. One is, can you just touch on the jurisdiction between the local police in the city and the sheriff, and what we as citizens who we would call for certain situations?
Well, we do have the Finger Lakes Drug Task Force, which is a combined effort between the Sheriff's Office and the Auburn Police Department. And they deal with the dealers, if you will, and the higher level dealers. If you live in the city, obviously 911 for any emergency. If you live in the city, there is a non-emergency number for the Auburn Police Department. If you live in the county, there's a non-emergency number for the Sheriff's Office.
And my other question is just how does marijuana fit into all of this? Does it fit into it in your approach for drugs, fighting drug use in the community? Because in my neighborhood, I see a lot of marijuana use, and I don't know how that fits into.
So from a prevention perspective, right, so you like these surveys that are being done in the school districts today, 3 districts in Cayuga County are being surveyed, we have information. So if you saw the article in the paper, so that you saw those percentages of kids who thought about and all that. Right, marijuana, alcohol, tobacco, you want to really impact kids' thinking and feeling about that. So everything, you really want to, push everything down and change attitudes. And a kid who, I don't know what's a straight line to what, but, why not just push everything down that's bad?
A simple answer, because it's been known as a gateway drug. I see alcohol as that, mainly, because it's the first one, usually that and cigarettes. But what I tell people is that if you've entered the supermarket, doesn't mean you're going to go down every aisle and purchase everything, but you're in the store. If you're in the store, that means your mindset is open to. And then you add the national change that's going on. If you're a young person, I think you're going to get very confused right now, because you see states legalizing and, all the stuff that's going on with that. Kids read, country, but they do read this stuff, but unfortunately they like to segue to what they want to know. And what I mean by that is, so they'll lock on to that and use that as an answer to the question. And that's difficult, because for prevention, because I have 2 prevention staff, they get all twisted with this, because they make a little traction, and then something like this pushes them way back again. So it is a big issue.
I have dealt with some recent cases where young men especially sustained sports injuries in high school and were put on prescription painkillers and became heroin addicts as a result of that. So it is not always recreational drug use by these kids that leads to the heroin problem. Sometimes it's a legitimate injury and a legitimate prescription, and they get in trouble.
So you should talk to people who whose kids have sports injuries, and you should be aware of this yourself, that 30-day script with 2 refills, you may not want to have your kid have access to that pill bottle. You may want to restrict that. You may want to talk about ibuprofen. You have to be very, just because a doctor gave it to somebody doesn't mean that it's okay in the long run.
Question for Kevin. In the county here, what options are there available for folks? Are there 28-day programs? Are there sober housing, living options and things like this? If a complaint comes, do we send them to you first and then you help them find these things?
I would say yes to that question, because we're sort of the entry point, and we can refer to those other programs depending on need. The other aspect is that some of the stuff isn't going to happen like we would like it to, like an inpatient. So in this community, you have CHAD, you have recovery counseling, which is a smaller outpatient program. You have Chapel House, which is basically a sober house. You have Grace House, which is a halfway house. But inpatient programs tend to be regionalized because you really couldn't, I could probably fill it if I was allowed, but because that doesn't work that way, they kind of have to be centered like near Syracuse or someplace else. But we tend to be the gatekeepers of those services, and we're the access point. So if you were to call us, we're going to make sure that we maneuver you to the right level of care, because my charge is to not try to put a Band-Aid on an open wound that won't heal, okay? But I can diagnose that that won't happen and then try to get you to that source. Did that answer
So
your
call,
question?
yeah, so call to you would
Yeah.
help them get
Yeah,
those.
and if I don't know, I'm going to get you to somebody that will know.
Meg, then John.
No, you've mentioned opiates and painkillers. Can you give us examples so people know what they're looking for in the medicine?
Hydrocodone, Percocet, Vicodin,
Orange labels.
Thank you.
with that little vehicle on there.
Controlled substances, orange labels.
So you call it an epidemic. Do you have data though, like, 5 years ago it was 10 cases, 3 years ago it was 50, now it's 100?
Well, treatment level wise, I can tell you that the number of heroin admissions annually up until the last couple of years was maybe 1 in 25. Now we're seeing about 10 in 25, and it's increasing even more because all the people who contact us don't follow through with coming into care too. And we get a ton of calls that they want something right now, like detox, but you can't always access that. But the number is going up, it's not coming down.
From January 1st to September 1st, the Auburn ER treated 68 patients for overdose symptoms of opiate or heroin related.
All of last year, less than 10.
So I don't have the stats.
And we don't use this word, I mean, I've been around Ray a long time.
Yeah.
We've never used this word, but we have to use it now because it's clear. It hit quick, it hit large, and it's got consequences. And so if we don't use those words and get people to respond properly, we're not doing our job. But your question is well first, because it is.
And my second question on that is, crack cocaine was a huge issue, especially for women and children, right, as well as the violent side of it, which is great that you're not seeing that side of it. But have you started to see the other sides of this, either HIV increases or?
We've taken 6 babies from Miles who, so we're seeing an awful lot of, we're seeing a spike in abuse and neglect family court proceedings. I mean, Judge, if he's still here, he can sort of echo that.
Told you not to call me out.
I did. So we're seeing quite a bit of this now. Babies born with, Suboxone addiction. The moms are in treatment, and yeah, we see a lot.
And
More so than we have before. Yeah.
Hepatitis C
Yeah.
being transmitted.
Dan Fessenden, I think that.
Kevin, just curious with this level of kind of demand for your services, how is an agency like Chad staying funded and staying ahead of this?
My hair was not white. But the best way to explain it to you is our funding source did this wonderful thing where they made us basically like a private business. We are like a doctor's office. We bill Medicaid, we bill insurance. But as Ray found out working with me, we've also run into a roadblock, which is for about 10% of my budget, which is state aid. The rest is earned income. When I prepare a budget to address what I want to address, I'm not allowed to do that. I have to use this percentage of how much your budget can go up. And then what happens is the overage that you earn sometimes goes back into the cauldron to be spread around to programs who aren't making their goals. That's really frustrating. Because to me, I figure if I run an efficient, well-run agency that does its job, we don't have cell phones, we don't go to conferences, we don't do all the fluff stuff. So everything we do, and Cindy's shaking her head because Cindy used to be on my board, so she knows, it goes right back into the operation of the agency. So when I do make the money that's necessary to make change, I don't get to use it the way I'd like to. And that's real frustrating because funding from New York State, I think, has not gone up in at least 15 years. And what the funding does is it allows me to have a cash flow in the first quarter of the year. But beyond that, we earn what we make. And the average counselor at my office makes $30,000. And, you know, Ray understands this. They want you to do more. They want you to do mental health work. They want you to know this. They want you to know that. Well, I would like the people who work for me to be paid a reasonable salary to be able to support their families, but also to be invested in the program they're in. But I don't think that's ever going to change, Dan. I mean, you've been around a long time to know this too. The environment that we're living in right now is not about more state aid. It's about less state aid. And as a result, we have to be creative. Drug court just got a grant recently that we're going to put trauma treatment into our program and add a staff member through that grant. So there's sometimes you get these little gifts, but they're 3-year gifts. But it is difficult because there just isn't a lot out there that's coming in. United Way gives us a small portion of money, but you know we've always worked on that sort of tight budget.
We have about 5 more minutes and a lot of hands, so Maureen, I think, was next.
Mine's not really a question, but just a reality check for the room. I bought my house about 5 years ago. I always thought I lived in a nice, quiet Polish neighborhood. And my cars were broken into on October 29th, and change was stolen and things like that. So, and it's a little embarrassing, but they were also broken into last Saturday. So, just a reminder to everybody to lock your vehicles and secure your property, and despite what neighborhood you live in, because it's not really your neighbors, they're traveling.
Monica?
You talked about that the first time you had a choice, when you use afterwards, you don't have a choice. And what really scares me is when we had that issue with the bath salts. You read all those things, how people reacted after they got high, and you read it in the paper. And kids were still curious enough to try it out, and even adults. So I was wondering, do you have funding, or do you have the ability to actually reach out into schools and try to scare the hell out of them with something? I don't know.
Well,
Not get to that first.
let's go on 2 levels with your question. One, yes, we do. The DART program has been around 25, 30 years. It's very effective. It's about healthy choices. We've done a lot of research and really came up with the concept that the scare tactics last about 5 minutes. I mean, we've all been through what I call the DWI crash thing, you know, where people are mangled and everybody goes out and throws up and I'll never do this, and then 2 days later they're in a car. So we've evolved and used evidence-based programming to tell us what does work. So we're really telling kids to make healthy choices and how to deal with peer pressure, because those are sort of the entry-level pushes you get. So we try that, but we've had that going for over 25 years. Kathy Duckett and Jim Hodges do this for me. They've been in the trenches forever, but we're never going to know the impact of that a lot of times because kids go through that growth process. But we are out there, and we're trying to do more through this the grant that Ray is working with to do more community education also.
Tim?
I just want to share on most of the tables here, and I have some here, and I'm going to distribute to the seated guests, is a medication cabinet safety brochure. And it gives all the information how to secure the cabinet, what to look for, and I can't stress that enough. It's been shared by our panel. That's how our young adults and whoever's addicted are getting the painkillers to, you know, get their addiction going. I also want to say too, especially when people go inpatient, or they may need outpatient, it's imperative for them, once they leave, once they're treated and move on, to maintain a support group. And that is, we're very fortunate in our community to have Alcoholics Anonymous meetings, Narcotics Anonymous, and also Al-Anon for our family members of our loved ones who are addicted. It's a family disease. It doesn't discriminate. And it's imperative. That's how addicted, be it an alcoholic or the drug addict, it's vital they have a recovery and a sponsor and work the 12 steps in their program to maintain a successful recovery. And we're very fortunate in our community to have the meetings. There's one in the morning, there's one in the afternoon, there's meetings at night. And that is how it works. Just want to mention.
Guess we have time for one more question. Who has the most pressing question?
My question is, what's happening at the regional and state level to address this?
Well, Ray was part of it, but we dealt with what came into town. Senator Nozzolio and some good folks came in and brought us on a panel, and a lot of good work got done. Where Dan probably can answer this better because I don't understand politics and I stay away from it very strongly. I don't know what happened to it. There was a nice big booklet that came out, and I tried reading it, and I'm like, okay. But what I wanted was for inpatient to become available in the front end and not on the back end. And I was hoping that would be at minimum an outcome. And what I don't know is if it's in legislation and it takes a while to get it out, or it died in legislation, or it looked good, but I think the support is there, but what happens politically for me is once it becomes not a hot button anymore, people move on to the next issue that's going on, like Ebola or something else, and we get forgotten. But I don't know what happened to that, because it was a lengthy deal. They went out for at least 6 months, did some really good work, got some great people on the dais to talk to them, and I just don't know what happened to it.
This is what happened to it. We always like the easy answers, so it's easy to throw money at a few things and not do the systemic changes. The issue around access to treatment's about money. Substance abuse, mental health, developmental disability systems are funded by Medicaid. New York State's been a pig at the Medicaid trial and getting sued by the federal government all the time. So they're staying way ahead of trying to reform the Medicaid system and move towards a capitated, risk-based managed care system. So that's what it ran up against. We're not going to make any more money available because we're pulling money out of the system to fund a transformation that's going to take a bunch of years that's sort of suspect, but we don't know the impact it's going to have on agencies. So that's what it ran up against, the reality of us trying not to get killed by the federal government, even though we deserve it, for how we've abused Medicaid dollars in New York State to fund services that should have been funded out of the general fund.
And the thing to understand, because Ray lives it with me, the state has now gone to manage Medicaid. The problem is, when you give a pool of money to a private enterprise and say, here's your profit, it means that the management of those benefits is what they make at the end of the year. Well, the incentive to take a risk and put somebody into rehab isn't there if that's my salary going downhill. So we've kind of made the lion in charge of the meat market, and it scares me because what's happening is, even with legislative change, you're still putting it into the hands of people who really don't care if you get well. I mean, they don't see you, they don't touch you, they don't talk to you. They just look at a book that tells them what protocol they should follow, and not everybody fits a protocol, And one of the things I tell everybody, I don't understand why they think we would send people to a program that don't belong there. There's no logic to that, to just say, okay, you want to go 28 days for a vacation? Okay? So clearly people have got this mixed up, but it is difficult because we call it mangled care, not managed care, because it is, and we're going to be fighting that for a while, and as Ray says, we're moving to performance outcomes, which in the treatment field scares me because it says, show me that you can cure people is really what they're telling you. And I don't think I got that ability. I have an ability to help you get to change, but I cannot change you personally or professionally. But those are the things we're facing. You had a question. I got to get you on.
Yeah, I was wondering, I heard a little bit in the press, of course, the press media, of course, underneath, but there was a bit of a challenge, I understand, bringing this to the forefront, the cost of heroin versus the prescription pills. What do you do about educating the public about that and why people are switching to heroin when potentially you're telling that abuser or person that there's a cheaper product out there for them? Isn't that like a very tricky?
What I would tell you is they're ahead of us by miles. So no matter what we say publicly, they've known it. Your internet, your cell phones, we've changed our society to you can contact 1,000 people in a second with Twitter or whatever. So I think they're so far advanced, we're sort of like bedrock.
So we need to just get it out
Yep,
there.
get it out there.
Issues out there, and yeah, there's a cheaper product, but they already know it.
Yep, they know.
Yeah.
Where's heroin made?
Afghanistan.
So it has to get from Afghanistan?
It's a plant. It's an opium plant.
It's such a profitable business. It's got no problem.
If you read the paper a couple days ago, they basically said that the more the troops move out, the greater the product goes up, because that's their national economic product. So clearly, that's where it's coming from. They know
So
it.
it's very cheap to manufacture.
Oh, yes.
If I can buy an amount for $10, the profit margin's not, you have to really sell a lot, it's volume.
They have a built-in audience, so our consumers, so I think that's exactly what's happening. They know that if they come in under the dollar amount, it's the volume that's coming out. Plus, once you get addicted, then you know you got that person for a while.
It's clear this is a very hot topic, but we are out of time. Let's show our appreciation to